It's important to consider your diet and beverage choices. When managing diabetes, it's critical to monitor your carbohydrate intake and any potential effects it may have on your blood sugar levels. To avoid blood sugar rises, the American Diabetes Association advises choosing drinks that are either calorie-free or low in calories. This will assist you in controlling your illness, preventing uncomfortable symptoms, and preserving a healthy weight. It's crucial to keep in mind that even foods with minimal sugar content, such vegetable juice, should only be drunk seldom. Lactose, a naturally occurring milk sugar, is also present in reduced fat dairy. Therefore, it should be included against your daily carbohydrate requirement. Dairy alternatives are not regarded as low-sugar beverages, it should be noted. Number 1. Fenugreek seeds. They work well as a natural diabetic treatment for type 2 diabetes. 10 grams of fenugreek seeds soaked in hot water and consumed every day can reduce blood sugar levels, according to research. The fiber in the seeds slows digestion and controls how quickly sugar and carbs are absorbed. Fenugreek water also enhances the body's absorption of sugar. Additionally, it has been reported to lower total cholesterol and triglyceride levels, which enhance lipid profiles. Although fenugreek seeds are typically harmless, some people may develop negative side effects, such as digestive problems, allergic responses, and a possible risk of hypoglycemia. If you are taking medicine or have a particular medical condition, you should speak with a healthcare provider. Number 2. Cinnamon. It reduces oxidative stress and stimulates insulin action to assist manage diabetes. Studies have demonstrated its efficiency in reducing type 2 diabetes patients' blood sugar levels. Add half a teaspoon of cinnamon powder to warm water to make cinnamon tea and sip it frequently. When used in moderation, cinnamon is generally regarded as safe, but it's vital to be aware of any possible negative effects. Due to the presence of the chemical coumarin, excessive consumption of cinnamon or prolonged use of cinnamon supplements may cause liver damage. Depending on the type of cinnamon utilized, coumarin levels change. Number 3. Black coffee. The polyphenols in black coffee have been related in several studies to a lower incidence of type 2 diabetes. Polyphenols improve glucose uptake into cells and decrease carbohydrate absorption to help control blood sugar levels. To truly feel black coffee's stabilizing benefits, it's crucial to stick to just that. These advantages may be hindered by milk, flavored syrups, and other sweets. However, as reactions to coffee may differ from person to person, moderation is suggested. Due to the caffeine in coffee, some people may have negative effects, such as faster heartbeat, jitteriness, anxiety, or disturbed sleep. Additionally, it could have a diuretic effect that causes more pee to be produced. Compared to Robusta coffee beans, Arabica coffee beans are thought to be of superior quality since their flavor is softer and less acidic. Additionally, Arabica coffee is a better choice for those who are more sensitive to caffeine due to its propensity to have less caffeine than Robusta coffee. Number 4. Green tea. Regular use of green tea, which is likewise high in polyphenols, can reduce the incidence of type 2 diabetes. It might be necessary to consume 6 cups of green tea every day to experience these advantages. Green tea in the powdered form known as matcha has more polyphenols. Compounds in green tea help lower insulin resistance, stress hormones, and inflammation. Iced green tea without sugar can hydrate without raising blood sugar. Although green tea is typically safe, some people may develop negative side effects, include caffeine sensitivity, gastrointestinal discomfort, and iron absorption problems. Consultation with a medical expert is crucial since green tea might interfere with some drugs. For better flavor and more advantages, get an organic whole-leaf green tea of superior quality. Number 5. Ginger tea. Gingerols, which are included in ginger tea, help control fasting blood sugar levels and enhance insulin sensitivity. It can help with blood sugar regulation and stop persistently high levels. After consuming refined white flour bread, studies indicated that persons who drank ginger tea, unsweetened green tea, or cinnamon tea as opposed to plain water saw smaller blood sugar rises. In a different study, it was shown that taking ginger supplements reduced fasting blood sugar levels and enhanced long-term blood sugar management in people with diabetes. Although drinking ginger tea is generally harmless, some individuals may have stomach pain or allergic responses. Additionally, it could interfere with specific drugs, so talking to a doctor is a good idea. Including ginger tea in a complete diabetes care strategy is recommended. Number 6. Green smoothies. They are a simple and efficient way to increase your consumption of fiber and nutrients while still staying hydrated. Adding green veggies to your smoothie, such spinach, kale, or celery, may greatly increase the amount of essential vitamins, minerals, and antioxidants you consume daily. Adding a source of protein powder to your smoothie will help you feel fuller and support the health of your muscles. To achieve the most nutritious content, making green smoothies at home with fresh ingredients is advised. Green smoothies are typically seen as being healthy, but it's vital to be aware of some substances that may be harmful to some people. Number 7. Kombucha. Probiotics included in kombucha, a fermented beverage prepared from black or green tea, can help type 2 diabetics better regulate their blood sugar. Kombucha's probiotics improve insulin sensitivity and lessen insulin resistance, which helps with glycemic management. The normal amount of carbohydrates in a 1-cup serving of kombucha is around 7 grams, making it ideal for low-carb diets. Although kombucha is typically helpful and safe, there are a few things to keep in mind. For those with sensitive stomachs or digestive ailments, kombucha's inherent acidity may cause problems. Number 8. Barley water. Due to its high insoluble fiber content, barley water is advantageous for regulating blood glucose levels in diabetics. The high fiber content slows digestion and controls how quickly sugar and carbohydrates are absorbed, preventing blood sugar rises. According to studies, eating barley helps diabetics maintain better glycemic control. 12 cups of rinsed barley grains should be soaked in water for 4 to 6 hours to create barley water. Number 9. Lemon water. There are a few possible advantages of lemon water for diabetes management. It has been discovered to lessen the surge in blood sugar levels by slowing the conversion of carbs to sugar. The American Diabetes Association considers lemons to be superfoods because of their high fiber and vitamin C content. They can prevent blood sugar increases because of their low glycemic index. Lemon polyphenols may improve insulin sensitivity and possess antioxidant qualities. Number 10. Apple cider vinegar. Small research investigating the relationship between apple cider vinegar and blood sugar control have produced conflicting findings. More human study is required. However, several studies in rats have suggested possible advantages in decreasing LDL and A1C levels. There is some evidence that drinking water mixed with apple cider vinegar may help lower blood sugar levels after meals. According to a meta-analysis of type 2 diabetes research, apple cider vinegar may lower HbA1c and fasting blood sugar levels. For possible advantages, organic, unfiltered, raw apple cider vinegar with the mother culture is advised, but it's crucial to proceed with prudence. In the end, it's critical to remember that while these therapies might support a strategy for managing diabetes, they shouldn't take the place of professional guidance or medicines that have been recommended by a doctor. Therefore, before introducing new treatments into your regimen, it's important to speak with a healthcare provider. Please remember to like and share this video if you find the information useful. To ensure you never miss an update, subscribe to our channel and click the notification bell if you're interested in learning more about managing diabetes and related subjects. We'd appreciate your time, and we'll see you in the future video.